Pancreatic cancer is a serious and life-threatening disease. It often grows silently and unnoticed, making it hard to detect early. This makes it one of the most challenging and difficult cancers to treat. However, understanding the disease, its risk factors, and available treatments can empower individuals to take proactive steps towards their health. The pancreas is an important organ in your abdomen behind your stomach. It produces enzymes that help you digest food. It also makes hormones like insulin, which regulates your blood sugar. Pancreatic cancer occurs when abnormal cells in the pancreas begin to grow uncontrollably. These cells form a tumor that can invade nearby tissues and spread to other parts of the body. There are different types of pancreatic cancer. The most common type is called pancreatic adenocarcinoma. It starts in the cells that line the ducts of the pancreas. Other, less common types include neuroendocrine tumors, which arise from hormone-producing cells, and pancreatic cysts, which are fluid-filled sacs that can sometimes become cancerous. While the exact causes of pancreatic cancer are not fully understood, several risk factors can increase your chances of developing the disease. These include smoking, obesity, diabetes, chronic pancreatitis, and a family history of pancreatic cancer. Age is also a factor, as the risk increases significantly after the age of 50. Pancreatic cancer often doesn't cause noticeable symptoms in its early stages, making early detection difficult. However, as the tumor grows, it can cause symptoms such as abdominal pain that radiates to the back, unexplained weight loss, jaundice, yellowing of the skin and eyes, and changes in bowel habits. If you experience any of these symptoms, it's essential to consult your doctor promptly. While these symptoms can be caused by other, less serious conditions, it's important to rule out pancreatic cancer, as early diagnosis and treatment can significantly improve outcomes. Diagnosing pancreatic cancer is a complex, multi-step process that goes beyond identifying the presence of cancer. It involves determining its stage, type, and extent of spread. This comprehensive evaluation is essential for developing an effective treatment plan. The journey often begins with a visit to a primary care physician, who may refer you to a specialist such as a gastroenterologist, oncologist, or radiologist if pancreatic cancer is suspected. The diagnostic process typically starts with a detailed medical history and physical examination to assess symptoms such as jaundice, weight loss, and abdominal pain. Blood tests, including CA-19, 9 levels may be ordered, though elevated levels alone are not sufficient for a definitive diagnosis. Imaging tests like ultrasound, kinetic scans, and MRIs provide detailed views of the pancreas and surrounding organs, helping to identify tumors and abnormalities. Each imaging technique has specific advantages, with CT scans offering detailed cross-sectional images and MRIs excelling in soft tissue contrast. If imaging suggests a suspicious growth, a biopsy may be recommended to obtain a tissue sample for microscopic examination. This procedure, performed via endoscopic ultrasound-guided biopsy or fine needle aspiration, provides the most definitive diagnosis by determining whether the tumor is benign or malignant and identifying its specific type. These insights are crucial for staging the cancer and tailoring the most appropriate treatment plan. Early and accurate diagnosis significantly improves prognosis and treatment outcomes for patients with pancreatic cancer. Once pancreatic cancer is diagnosed, doctors must determine both its stage and grade. Staging refers to how far the cancer has spread within the body, while grading describes how abnormal and aggressive the cancer cells appear under a microscope. Together, these factors help guide the best course of treatment. Early-stage pancreatic cancer, which remains confined to the pancreas, is generally more treatable than advanced-stage cancer that has spread to other organs. Pancreatic cancer is a challenging disease, and survival rates vary depending on the stage at diagnosis. However, it's important to remember that statistics only provide averages. They do not predict individual outcomes. Many factors, including overall health, the specific type and stage of cancer, and response to treatment, influence a person's prognosis. While statistics can feel overwhelming, focusing on the present and working closely with your healthcare team can help ensure the best possible care and support. In the realm of medical science, hope often comes in the form of groundbreaking research and innovative treatments. Pancreatic cancer, one of the most challenging cancers to treat, has seen remarkable advancements in recent years thanks to the dedication of researchers, clinical trials, and medical professionals. While surgery remains the primary option for early-stage cancers, it is not always feasible for all patients. Due to the complexity of the disease, a multifaceted approach is often required, involving collaboration between surgeons, oncologists, and researchers to create personalized treatment plans. New therapies such as chemotherapy, radiation therapy, targeted therapy, and immunotherapy are constantly evolving to improve patient outcomes. Chemotherapy and radiation therapy work by killing cancer cells, while targeted therapies disrupt specific molecules responsible for tumor growth and spread. Immunotherapy, an innovative approach, harnesses the body's immune system to recognize and attack cancer cells, offering potential long-term protection against recurrence. Clinical trials play a crucial role in advancing these treatments, helping scientists evaluate their effectiveness and develop even more innovative approaches to combating pancreatic cancer. Patients who participate in clinical trials not only gain access to cutting-edge treatments but also contribute to future breakthroughs that may change the landscape of cancer treatment. A diagnosis of pancreatic cancer can be life-changing, but you are not alone. The journey ahead may feel overwhelming, but a strong support system, including medical professionals, loved ones, support groups, and self-care practices, can provide strength and comfort. There are many resources available to help you and your loved ones navigate this journey. Hospitals and cancer centers often offer educational materials on treatment options, coping strategies, and ways to manage side effects. Support groups, both in person and online, provide a safe space to share experiences, connect with others facing similar challenges, and find encouragement. Whether you prefer face-to-face meetings or virtual discussions, there is a group suited to your needs. Therapy and counseling can also be invaluable in helping you cope with the emotional and psychological challenges of a cancer diagnosis. Professional therapists can provide guidance, coping strategies, and emotional support, helping you manage stress, anxiety, and fear. Talking to someone who understands can be a powerful tool in navigating this journey. In addition to professional support, lean on your healthcare team, family, and friends. Your medical team is there to answer your questions and provide the best possible care, while your loved ones can offer emotional and practical support. Asking for help is a sign of strength, not weakness. Prioritizing self-care is just as important. Engaging in activities that bring you joy, whether it's meditation, spending time in nature, or pursuing hobbies, can help maintain both physical and emotional well-being. These small moments of normalcy and joy can build resilience and strength as you navigate your cancer journey.